So bladder cancer, I guess typically things people would want to know is that it's associated or most commonly picked up when people have blood in the urine. So if you urinate blood or see blood in your urine, don't ignore it. That's a sign that you need to see a urologist. It's one of the more common causes of what we call gross hematuria, or blood in the urine grossly, that people see, and typically it's painless, no pain associated with it, unlike some other causes like kidney stones and stuff. It's highly associated with smoking, so cigarette smokers have a much higher increased risk of getting bladder cancer. There are some other associated risk factors: exposure to certain aniline dyes, different benzenes and things of that nature, but by far and away the biggest risk factor is cigarette smoking. Bladder cancer typically peaks in the age groups 60s and 70s, and it's more common in men as well than women. But again, sort of mirroring some of this smoking statistics and time to develop some of those cancers. Another one that we sometimes have to remember is people that have chronic indwelling catheters can be at higher risk of getting bladder cancer because the bladder is chronically irritated. So essentially a number of chemical compounds, with cigarette smoking being the predominant one, and then anything that irritates the bladder, indwelling catheters, parasitic infections, even certain types of chemotherapy can put you at increased risk of bladder cancer. There's also some studies suggesting that radiation can put you at pelvic radiation can put you at increased risk of bladder cancer, such as that seen in patients who have had cervical cancer or prostate cancer in their lives. There are definitely other causes of blood in the urine, so things like kidney stones. There are some vascular abnormalities that can cause blood in the urine. In men, something as simple as an enlarged prostate, which happens in all of us as we age to some degree, can cause blood in the urine if it gets to be really big. Kidney cancer is also another bad cause of blood in the urine. So when we see blood in the urine as urologists, the primary, or at least my mindset as a urologic oncologist, is to rule out the causes that can kill you, and the two that can kill you are kidney and bladder cancer. So anybody that comes in with blood in the urine, we do two tests. One is an imaging of the abdomen, either a CT scan or an ultrasound typically, to look at the kidneys and make sure there's not a kidney tumor. And then we do a procedure called a cystoscopy, where we actually go up and look at the lining of the bladder with a little fiber optic telescope to look for a bladder cancer, because that's the way they sort of show up. That's how we diagnose them, and they have a very characteristic look when we go up and do a cystoscopy. They're a little papillary frondular lesion, and it's pathognomonic for bladder cancer. Basically, anybody that urinates blood needs to see their provider, and typically they're going to be coming to a urologist if they've urinated blood for those tests that we've sort of discussed. Ultimately will culminate in some sort of imaging of their kidneys, be it a CT scan, an MRI, or an ultrasound, plus the cystoscopy, which is the procedure where we look at the bladder. Unfortunately, there's not a good X-ray test for the bladder. It pretty much requires us looking at the lining of the bladder, because some small bladder tumors or flat tumors called carcinoma in situ can be missed on an X-ray, so we actually have to go up and physically look around the lining of the bladder with a little telescope. So the prognosis for most patients with bladder cancer is quite good. About 80% of them present with what's called superficial bladder cancer or surface-oriented bladder cancer. When we find a tumor, we then schedule them for the operating room and go in and scrape it out with an operation through the urethra, the tube you pee through. That tumor then goes out to the pathologists, who look at it under the microscope and tell us how deep the tumor is into the lining of the bladder, and that's the real main differentiating point in bladder cancer. So superficial bladder cancer, which is anything above the muscle layer of the bladder, which are about 80% of bladder cancers, they may end up needing, those patients may need some chemotherapy into the bladder to prevent a recurrence down the road. But in general, for most of those patients, it's more of a nuisance. We have to keep scoping them because it can recur over time, but it's not typically life-threatening. The other 20% have what's called muscle-invasive bladder cancer, where the cancer's actually into the muscular layer of the bladder under the microscope. And those patients are at much higher risk of metastases spread throughout the body and ultimately death of bladder cancer. Those patients go on a whole different pathway of treatment that typically involves IV or systemic chemotherapy, plus in appropriate patients an operation to go in and remove the entire bladder and pelvic lymph nodes, which is a pretty big undertaking. So that's our main algorithmic delineating point, is superficial or deep. We can't tell that when we look in the office. We find that out after we scrape the tumor out and get a pathologic microscopic examination report back. For patients with metastatic bladder cancer, or bladder cancer that has spread beyond the bladder into the lymph nodes or beyond into the lungs, typically has a very poor prognosis, does not typically respond well to most chemotherapy agents. and those patients ultimately tend to not do well. For prevention, not smoking. So if you're a smoker, wean yourself off. Stop smoking. There's a whole host of other reasons you'd want to do that as well, but probably the biggest thing is not smoking is the most important thing. Other than that, there's not really a whole lot of preventative measures to be taken. If you work with certain chemical compounds, make sure you follow appropriate manufacturers' directions as far as handling those compounds at work or at home in the home setting. Short of that, there's not a whole lot of preventative maintenance, so to speak, when it comes to bladder cancer. Again, the key is really in most patients catching it early, and so if you ever pee blood, that's when you want to seek medical advice. Don't wait on it. Even if it goes away, you still want to have it checked out. If you urinate blood, that needs to be addressed. As with most cancers, catching it early usually portends a better prognosis, and I can't overemphasize, if you pee blood, seek medical attention immediately. And most patients do. When they urinate blood, they see blood coming out, they tend to find us pretty quickly, but some don't. And so definitely important to follow up with your provider if you're urinating blood.